Hey everybody! Today I wanted to spend some time talking about the coronavirus, or COVID-19, and how we can all better manage our anxieties during this global pandemic. I know this is a stressful time, and that's why I partnered with UNICEF to offer some insight and resources so you hopefully will feel a bit more empowered with helpful tools you can use today. Many of you have reached out about this, sharing how you're feeling super stressed out, constantly on edge, or even hypervigilant. First, I want to let you know that all of these things are completely normal and are warranted responses to all of the threats that we're hearing each and every day via the news and social media. Since my good friend Dr. Alexa Altman specializes in trauma and its treatment, I reached out to her for her insights, and you might remember her from our many videos together about trauma. And she had some really helpful things to share about why we feel the way we feel. She stated that our nervous system is always assessing our environment for safety and/or danger. If it senses a threat to our safety, it will help us focus on it so that we can be ready to take action against the threat if needed. Really, this helps keep us alive. If we're always on the lookout for something or someone who could harm us, then we're prepared to act when that threat becomes imminent. But because the current threat is a small virus with no known treatment yet, and an uncertain timeline for when it will invade our communities, we aren't able to use our fight or flight response in an effective way. We can't fight or run from the coronavirus like we could from a bear. And Alexa explains that it's like our nervous system is gearing up for action without having any outlet for that energy. Therefore, we can feel really ramped up, easily agitated, and anxious each and every day. It is my belief that this is what's leading to the panic response of people stocking up on toilet paper and canned goods, as well as people taking out their anxieties and upsets onto others. Reports are emerging from around the world of individuals, particularly of Asian descent, who have not been in an area of ongoing spread of coronavirus or had contact with a confirmed case, and they're being subjected to verbal or even physical abuse. This should go without saying, but viruses cannot target people from specific populations, ethnicities, or racial backgrounds. This not only traumatizes and stigmatizes people, but also isolates them. And if someone did worry they had some of the symptoms, they may put off getting tested or treated for fear of what their neighbors or community members will say and do. And the last thing we want is for people to put off getting tested or treated, because that will only help the virus to spread and affect more people. So what can we do? Because being in a prolonged state of threat can cause us to make bad decisions, start fights, and further isolate or go into a state of freeze. Well, don't worry, we've got some helpful tips for you. And the first tip is to continue to engage with people who are close to us and feel safe. The main antidote for the stress response is social interaction. And not to get too nerdy on you, but Dr. Stephen Porges conducted research on this very thing and came up with the polyvagal theory. In short, while studying our vagus nerve, Dr. Porges identified a third type of nervous system response. We used to think that we only had two, an activating or a calming one. But this third response he identified was the social engagement system. What he found was that instead of our nervous system being either more activated or less and less calm, or more calm and less activated, it could do a little bit of both. We could be activated through social interaction while also calming our system down. It's the safety that we find in true connection with others that helps us manage, and more quickly I might add, calm the stress response. I know people keep telling us not to see our friends or interact with people, but we can still find ways to connect with others. Maybe it's just close family that we already live with who we know aren't ill, or perhaps it's online through Skype, Google Hangouts, chats, etc. By doing that, we will stop feeling so hypervigilant and begin to feel much more calm. My second tip is to take action where you can. If cleaning your house, buying a mask, and using hand sanitizer more helps you feel more empowered and calm, go for it. Like I shared earlier, it's the inaction that's keeping us stuck in this heightened emotional state. If there are some things that we can do, let's do those. Taking a more active role in your health is always a good thing. Number 3, limit the time you spend online or watching the news. With all of the coverage and some false facts swirling about it, it can feel even more overwhelming to our system, not to mention confusing and scary. I mean, did you guys hear the one stating that eating ice cream or other cold foods could help you fight off the coronavirus? Yeah, that was online, and it's obviously untrue. Now, of course, I don't mean we shouldn't be informed. So I will link some reputable sources that I receive from UNICEF in the description below. We can check in on what's happening every so often, and then disconnect, so that we can give our nervous system the time it needs to relax. The 4th tip was the most interesting one that Alexa offered, and that is to refrain from making big decisions. When we are in prolonged periods of threat or stress, we aren't able to use our wise mind. You know, the part of ourselves that's not clouded with emotions and upset, and therefore we can make impulsive and unhelpful choices. If I think about it, it makes sense because we aren't able to really think clearly when we're in fight or flight. We're just trying to survive. So if you can, save any big decisions you need to make for when your system is more calm and balanced. And the 5th and final tip that I want to offer is to take time each day to let your body come down. What that means is to actively allow the muscles in your face, jaw, shoulders, head, and neck to relax. These are all muscles that are engaged when we are in threat mode. By actively allowing them to relax, we give our bodies the message that we are safe and okay. Since I know many of you still have concerns about your own health and safety, UNICEF wants to offer 4 steps you can take to keep you and your family safe. And the first, we've heard this one a lot, wash your hands frequently, including every time you enter the home or office, after shaking hands with other people, after you cough or sneeze, and before you eat. And make sure you're using soap and water or an alcohol-based hand rub. Number 2, cover your mouth and nose with a flexed elbow or tissue when coughing or sneezing, and dispose of those used tissues immediately and wash your hands. Number 3, avoid close contact with anyone who has cold or flu-like symptoms. And 4th, please seek medical care early if you or your child has a fever, cough, or any difficulty breathing. I hope these tips and tools are helpful, and this video helped calm your anxieties and fears. Thank you so much for watching, and I will see you next time. Bye.